COVID-19 vaccines. Everything you need to know. The largest vaccination effort in history is now underway. Now that the COVID-19 vaccines have reached our shores, here's what you need to know. How safe are the COVID-19 vaccines? COVID-19 vaccines have been subject to the same checks, balances, and scientific and regulatory rigor as any other vaccine, and have been shown to be safe. What are the different types of COVID-19 vaccines available? Malaysia has procured vaccines from a variety of sources. Each works in slightly different ways and has unique properties that make it suited to certain situations.
Pfizer-BioNTech. Officially known as Comirnaty, but commonly referred to as the Pfizer vaccine, it is manufactured in the US and Europe at Pfizer and BioNTech's plants.
This particular vaccine has been one of the most talked about due to its wide use and novel approach.
Pfizer-BioNTech.
BioNTech.
The vaccine produces a harmless piece of spike protein to trigger an immune response in order to fight off the virus should it enter the body. Pfizer-BioNTech. Efficacy around 95%. Dosage 2 doses, 3 weeks apart. The CoronaVac, made by China-based Sinovac, is set to roll out on March 18th. It's unique in that it uses a killed viral particle to produce an immune response, unlike any of the others set to reach our shores. While it has been given conditional registration in theory, it still needs to be approved once it is locally fit and finished to ensure the vaccine is still potent after the process. How it works. This vaccine uses killed viral particles to expose the body's immune system to the virus without risking a serious disease response. This vaccine, which uses inactivated vaccine technology, is similar to the flu vaccine. Sinovac. Efficacy over 50%. Dosage 2 doses, 2 weeks apart. We have also signed deals for 3 other vaccines, with Russia's Gamaleya Research Institute, China's CanSino Biologics, and Europe's AstraZeneca. Pending registration from the National Pharmaceutical Regulatory Agency, they are likely to arrive later this year. Will there be any side effects when administered any of the vaccines? So far, there has been no severe side effects reported. However, you may experience some temporary side effects, such as pain, redness, swelling, a combination of both around the injection site, tiredness, headaches, muscle aches, chills, fever, nausea, a combination of both. Which vaccine works best for me? While efficacy rates differ, this should not be the yardstick to compare vaccines, as they are tested under different circumstances. In the most ideal situation, a vaccine should provide total immunity, so you don't fall sick at all. But realistically, the real aim is to provide you immunity against severe symptoms, hospitalization, death, so even if you get infected, it will feel like a common cold. This is the underlying objective of all vaccines. In all of these vaccine trials, no one has died or been hospitalized thus far, even after getting infected. Efficacy is important, but it is not the most important thing. Simply put, all of these vaccines can help end the pandemic. So, which vaccine works best for you? Well, the one you administered.
Whatever vaccine has been approved by the NTRA is safe and efficacious.
Who is responsible for the distribution and storage of COVID-19 vaccines? The Ministry of Health oversees the vaccine distribution, while MOH's Pharmaceutical Services Division is responsible for the logistics and ensuring that the vaccines are stored properly. The coordination of the rollout is being headed by Science, Technology and Innovation Minister Khairi Jamaluddin, who are eligible to receive the COVID-19 vaccine. Currently, only those above the age of 18 will be considered. When will the vaccination rollout take place? The vaccination program will be rolled out in 3 phases. Phase 1, February 26th to April, frontliners. Phase 2, April to August, high-risk groups. Phase 3, May to February 2022, adults aged 18 and above. Is it compulsory to take the vaccine? It is highly encouraged to help our nation achieve herd immunity. That requires 80% of the population having to receive one of the vaccines. How do I register for the vaccination program? Registration can be done through the MySejahtera app, which was recently updated to include the steps involved in the process. When it is your turn to be vaccinated, you will receive a notification about as to which vaccination center to receive it. For more information, call 1-800-888-828 or visit vaccinecovid.gov.my.